going to implant to it. So if it cannot be hospitable to a new human life, a tiny human being, that human being cannot survive. Therefore, it will die, and therefore it will fall off. And what do we call that?
That's an abortive
That's abortion. That is the abortifacient action of artificial hormones and preparations.
Okay.
That is the...
that's what makes it immoral for you.
Yes.
And as far as the church is concerned, what is all right with you is natural family planning, like, what do you call it? The ovulation,
the Billings method,
among
others. There's the symptothermal and
although there
others.
is an argument that even that is so unnatural, di ba?
I
mean, if we would go by the old...
Well, the church's understanding or terminology of it is natural or artificial. It's not natural or modern, not modern, it's artificial. By reason of the fact that the right to health of the woman, the natural method does not invade the natural reproductive processes as created, you know, in the woman's body. There are natural processes there which will, when you impede or, you know, you mess up with it, certain disorders will follow as a consequence, like the cancer, you know, and all the disastrous and even perilous consequences to women's health and women's lives. That is not health. We would not call that health, that's harm. So can anything be more immoral than to appropriate public money for immoral or pernicious substances, where the Constitution has mandated the state to protect consumers against dangerous substances?
Yeah. Well, it's good Congresswoman Garin is also a doctor, no? So is that really dangerous? Are those, well, contraceptives dangerous, harmful to women?
Definitely not. If these are dangerous, this will not be out in the market being approved by US FDA, by the Bureau of Food and Drugs in the Philippines. Of course, I do respect the opinion of Attorney Joy Mbong, but with the concept that it prevents human life, it is a misnomer in the sense that, well, I do agree that the sperm is a living cell, the egg cell is a living cell, the zygote, which is the union of both the egg cell and the sperm cell, is a living cell, but it's not a connotation as the start of life. When we talk about fertilization, there are millions of sperm cells, and only one will be successful in fertilizing an egg cell.
But as far as the church is concerned, because it's artificial, therefore it is immoral.
Well,
it you know, intervenes, it interferes in the natural process of things, di ba?
It's more immoral to raise children when you cannot raise them. It's more immoral to bear children in this world and then you left them with no education, no food. It's more immoral to allow poor quality of life within our people. While it is true that Mr. Thomas Zias of the Population Commission mentioned that he immediately sent us documentations to prove that his meaning was different. He told us that he made that statement in haste and presented the misinterpretation that he had. And then he further confided with us and told us that he is having a difficult time because of external pressures. And I do respect him. I do understand him. I can feel the pressures that he has been through. Well, that is also something that I would like to beg of the Catholic Church. Let us live on mutual respect. Let us live in a democratic society where each of our individual opinions will be respected.
Okay. Earlier, well, you were already talking about poverty, no? How immoral it is to bring a child into the world and not be able to feed, clothe, and shelter, educate him or her. But how, you know, the processes, the methods that you suggest, how exactly is it going to manage population? How are you going to
It simply says empowering the Population Commission and providing for the proper education through a system of government, within the government, which will be headed by the Population Commission and which will be handed down to the local government units, up to the rural health physicians and to the newly trained barangay health workers. It simply means giving proper information and access to those who would want it. We are not imposing only artificial family planning. We will be advocating artificial family planning. The church can help us in natural family planning, and it's for the couples to decide, because as far as I am concerned, 80% of the population use a combination of both. In this time of difficult economic times, usually the husband and the wife live separately because one would be working on another place. They would meet probably once a month or once every 2 months, and this would entail a combination of both artificial and natural family planning method. On the issue that this is immoral, I'm sorry, but I beg to disagree. When we talk about the start of human life starts at implantation, wherein a fertilized ovum would be implanted in the wall of the uterus, and maternal blood would flow, because without that maternal blood, there will be no multiplication of life.
Won't you get the same result if you have, like for example, the Billings method, ovulation method? Won't we get the same results?
The Billings method, all natural methods, based on the medical parlance and accepted degree of success, is only 40% successful. Why? Because each individual woman is her own individual physiological makeup. Now, if even
are you
condoms
saying mas madali yung condom or yung
it's not
pills,
na mas madali.
injectables, patches? I mean, is it, you know, in this day and age, kasi the faster the results are seen, you know, the more convenient.
It's not actually that it's more convenient and it's mas madali. No, it's the degree of success in terms of planning your pregnancy, avoiding getting pregnant, because condoms would be somewhere around 80% effective. Bilateral tubal ligation is 99% effective. The only 100% effective method is abstinence, which is, well, see, the church is telling us to advocate it, but we also have to be practical in accepting that abstinence is contrary to the physiological makeup of men and women, because whatever we do, we can prevent them from copulating.
Attorney Imbong, is it immoral for a woman to want to plan pregnancy?
The church holds that every spouse, every woman for that matter, has the personal freedom to decide for herself. But she has to use means which are licit, meaning those which do not invade the integrity of her body, because we respect the integrity of the body of the woman and the man as well. And so with respect to these preparations which are artificial and with their carcinogenic effects, which have been proven by medical cases and records, or replete in fact with records, I wish to correct the impression of my friend. It's not my personal opinion that she respects or whatever. It's actually it's based on the findings of the International Agency for Research on Cancer, WHO, the Mayo Foundation, which also found the cases of the carcinogenic effects and the tendency to cause all these deleterious perils to women's health. On that respect, therefore, the right to health is already violated. That is naturally, that's immoral.
But the church realizes we do have a very big problem here. It's so huge. I mean, our population numbers are going up so fast.
That is not correct.
So what?
Again,
that's
we
not
beg to
correct.
disagree very strongly.